Hi, everyone. Thank you so much for joining. I'm just going to give it another couple of minutes as people are slowly joining the meeting. But yeah, we'll just get started in a minute. And just to let everyone know who's joining, this is a recorded event for admissions. So please feel free to, not have your camera on if you don't want to. And Jen, if you could just keep an eye on the waiting room and just throughout, if more people drop in, feel free to admit them. That would be great. Okay, I think this is almost everyone. And just let you know, this is recorded, so you don't have to have your camera on if you don't want to. Okay, so I think we'll go ahead and get started. Hi, everyone. My name is Gabby Miosa. I am a current P3 in the PharmD program and the president of SSHP. Tonight, we're doing a really great clinical pharmacist panel. We have 5 amazing alumni donating their time today. We're going to go ahead and kind of go around, let them introduce themselves, explain what role they're currently in, and then we're going to get started with, a few rounds of questions. And then at the end, if anyone has any questions or if you have questions throughout, we do have our president-elect monitoring the chat, so we'll be sure to answer all of those. So whoever wants to get started, feel free to go ahead and introduce yourself. Anyone can go.
I'll get us started.
Thanks.
So my name is Joe Nardolillo. I'm a clinical assistant professor here at URI College of Pharmacy. I have, within that role, have a dual practice site with Rhode Island Primary Care Physicians Corporation and Integra Community Network. Basically, what that means, short, is that I work in primary care. I have in a clinic experience where I help manage patients with different diseases like diabetes, high cholesterol, high blood pressure. I'm from URI, obviously. Earned my PharmD here, and then did some work out west with the Indian Health Service and the University of Colorado for residencies, and then was faculty at a different pharmacy school for a few years, and was fortunate enough to come back to URI about 2 years ago this summer. So excited to be here today.
I can go ahead and go next. My name is Emily Gill. I graduated from URI in 2017. From there, I did my PGY1 at the University of Toledo Medical Center, followed by my PGY2 in critical care at MD Anderson Cancer Center. Right after residency, I took a job at Barnes Jewish Hospital in St. Louis, Missouri, and I've been there ever since. I currently work in their oncology and stem cell transplant ICU. So the patients admitted to my unit are all immunocompromised and have a pre-existing diagnosis of cancer, which is a pretty unique job from a critical care perspective.
I can follow up next. I'm Brady Quinn. I'm currently an inpatient hem-onc pharmacist at Maine Medical Center up in Portland, Maine. I graduated from URI in 2019 and then went on to complete my PGY1 pharmacy residency at UVM Medical Center in Burlington, Vermont. And then I moved on to my PGY2 at Maine Medical Center in oncology. Left from Maine for about a year, went down to Boston and area and worked at Leahy Hospital and Medical Center for a year, and then moved back up to Portland and have been here ever since. I currently, as I said, focus on an inpatient side and really treat a lot of patients with acute leukemias, lymphomas, and patients that are acute enough to be on the inpatient side and on the inpatient hematology and oncology rounding services.
Elena, if you want to go next.
Yeah, I'll go next. So my name is Elena Beauregard. I graduated URI in 2020. From there, I went to Richmond. So I was at the VA in Richmond. I did a PGY1 focused in mental health, and then I loved it there. So I stayed on in Richmond at the VA and did a PGY2 in psychiatry. And then after that, I stayed on for another year and I worked in the residential treatment program in Richmond. It's their 28-day treatment program. Patients with alcohol use disorder, stimulant use disorder. We saw a lot of cocaine and opioid use disorder. And then after that, I actually have moved up to the DC area and I work out of the Baltimore VA, and my role has switched somewhat. So now I am a chronic pain clinical pharmacist, and I work within the chronic pain clinic, but I'm also kind of the bridge person between primary care and our specialty chronic pain service. Um, and I think, and I just love what I do. So that's pretty much it to start.
I think I'd be next. So my name's Gabrielle Davis. I actually graduated with Elena in 2020. I have a non-traditional path as to where I am today. So I actually started in community pharmacy in Rhode Island, was a pharmacy manager. After 2 years, I decided to pursue a residency in managed care. I currently am at Hill Physicians Medical Group and Pri-Med Consulting Management in Northern California, which I love. My day-to-day responsibilities are a little bit, they flux a lot, but what I currently do is I manage our diabetes patients as well as our CSNP population. And then on the other half of what I do is I work with community-based organizations to get our patients resources that they need. I might go a little bit more into that after, but that's my general introduction.
Great. Thank you all so much. So I know some of you started to talk about it a little bit, but if we could dive a little bit further into what your day-to-day responsibilities kind of look like. And I know with some of you, it can differ greatly depending on the day, but just try to give us a little bit into like the scope of what you do with your job. So Brady, if you want to start.
Sure, absolutely, I can. So on a day-to-day basis, you know, the morning usually starts for me with rounding with the Med A service. So I'll round with them in the morning, and you know, provide any recommendations to the team that need to happen there, as it is a teaching hospital. So we do have a full team usually of hematologist, fellow, med student, and usually a medical resident, a senior, and an intern. So I'll round with that team and then, you know, make any recommendations on our service that need to be made for, again, usually acute leukemic patients. For the most part, these patients are, you know, usually always immunocompromised or about to become immunocompromised. And then we'll also, you know, get any chemotherapy preparation that needs to be ready for the day. So get our orders in check, make sure I run through those orders and make sure they all look great from a pharmacy standpoint and from a patient care standpoint, and make sure the supportive care and chemotherapy is really all queued up and ready to go. And then, you know, go through those orders, verify our chemotherapies, go through all of our consults, whether that's vancomycin or warfarin consults for other patients that are on our floor, and do all the verification for those patients. Usually we do inevitably have a student or a resident on service with us too. So we'll have plenty of pharmacy students and pharmacy residents working through our rotation as in inpatient hemonc rotation. So that's a general overview of a day in the life as a hemonc pharmacist at a medical center.
Awesome, thank you. And Emily, I'd love to hear how yours differs. I know you do have some oncology overlap, but I know it's a bit more critical care setting.
Yeah, so I am formally critical care trained, and the way it works in our unit is our team is a nurse practitioner, physician assistant based team. So we don't have any medical residents, but we have 2 advanced practice providers, a pulmonary critical care fellow, and then a pulmonary critical care attending. And so the rounding team consists of those 4 individuals in addition to me, and my unit consists of 13 patients. And really, we focus on the ICU problems for the patient and what brought them to the ICU as opposed to managing their specific malignancy. So that's essentially how it differs. But my job and my role is pretty similar to Brady's, where I'll round in the morning with the patient, with the ICU team, make recommendations related to medication changes or any thing related to optimizations of medications for those patients. A lot of things have to do with antimicrobial adjustments, glycemic control, anticoagulation recommendations. And then we also do a lot of research into potential chemotherapy or oncologic complications related to their disease, and if that might be playing a role in why they're in the ICU. So I guess that's where the most of the overlap comes into play. But we also have oncology inpatient teams that are also following all of our patients within the ICU. And so there's a lot of collaboration with that team to discuss how our medication or treatment plans might overlap while the patient is in the unit.
Great. Thank you so much. Would anyone like to go next? How about Elena? Yeah, go for it.
Yeah, I can go next. So my day-to-day responsibilities, I feel like everyone's a little bit different, but mine is pretty much patient care all day, most of the days. I do have a couple meetings sprinkled out that I attend with the chronic pain service. So I have three different ways that I do my patient visits. So I have telephone calls. I also have a face-to-face clinic, and then I also do like virtual care as well, which I think is really great. And a lot of the veterans really like virtual care. So I see patients for their chronic pain, which ranges from diabetic neuropathy. Sometimes I see more complicated patients. I just saw a patient with ALS. So it's a wide variety. I see patients from all different services. So we get referrals from primary care. We get referrals from home-based primary care. Every once in a while, I will help a little bit with inpatient, but I'm primarily focused with the outpatient service. And I do a lot of opioid tapers, transitions from their current opioid to a safer opioid, a lot of naloxone prescribing and education. And I work closely with kind of the chronic pain service, offering, medication changes, which is primarily what I focus on, but of course, a lot of our non-pharm options too. So we have a physician that does acupuncture within our clinic. We also have 2 pain psychologists, nurse practitioner. We have an interventional pain specialist. So we all work together pretty often. I'm called in for patient visits if they have med questions. Yeah, it's really great. It's nice to be part of such a great interdisciplinary team.
That sounds amazing. And Dr. Narlo, I know you also do more ambulatory care focus, so I could see how that could be similar to Elena's possibly.
That was exactly what I was going to start with and say that, we say ambulatory care quite broadly, but really I think it's always exciting to listen about how that can take different shapes and in different settings. So I'm part of a team of about 12 or so pharmacists now. That my role is a little bit different because I have a shared position with the College of Pharmacy. So on that side of things, very briefly, taking students, doing some didactic teaching in the classroom, also doing things such as research, which is involving different aspects of ambulatory care, cardiometabolic disease, health disparities, LGBTQ health, a lot of different expanding areas in that space. And from a clinical kind of day-to-day side, so I take students with me very regularly, usually have 1 or 2 in clinic, and we follow a model that we're hoping to continue to grow a bit more. So what I do is pretty much I have a shared schedule. I have my own schedule. I utilize what's called a collaborative practice agreement to work alongside our physician and our advanced practice colleagues to really be able to kind of help streamline time between those visits. So sometimes we have face-to-face visits, sometimes we do telephonic, really managing and helping to control and optimizing medications for things like diabetes, hypertension, hyperlipidemia. We also have a lot of just different aspects from like polypharmacy. So really kind of sitting down with those patients and telling them to bring in every single thing from home. Let's make sure we have an updated record. Let's make sure that they feel as comfortable as possible taking those medications, and really make sure that they feel involved in that process. I would say to patients, we're going to make it as simple as we can and make sure that everything you're taking you need, and that I'm not going to give you anything you don't. And I think people really enjoy that shared decision and having some of those conversations. I work with a lot of patients of different backgrounds with different social determinants of health needs and such. So really enjoy that day-to-day experience. We also do some other population health things like annual medication reviews, helping out with adherence and transition to care. So if patients get discharged from the hospital, they'll have a pharmacist review their medications within just a couple days of there. So wear a lot of different hats, but really enjoying and kind of was able to build on a lot of my previous experience and bring it to this role. So excited to see it continue to grow.
Sounds like you do a lot on a day-to-day basis.
Always.
Similar to Joe, I wear a lot of different hats as well. My position was created by me. So I post-residency was able to kind of hone in on what I enjoy in pharmacy, as well as still meeting the needs of our patients. So half of my day is spent doing telephonic medication reconciliation. I manage our CSNP population, so that involves diabetes management. We also have a CPA as well, so I'm able to do a lot on that side. On the other half of my time, I spend a lot of time in meetings with physicians, vendors, our community-based organizations that we work with locally. So what I do there is I help, Joe had mentioned social determinants of health. So if anyone on this call isn't familiar with what that is, that's things like food insecurity, transportation, just to name a few of many that we can help our patients with. So I go within the community and try to figure out a plan as to how we can help some of our patients. So a good example of initiative I just kicked off was I worked with a local library as well as a local food bank, and then I ran a hypertension class as well. And then after the class, the patients received free produce from the food bank. So that's something we did in English as well as Spanish in a low income area, and it was really successful, and we're hoping to expand more. Most people think of managed care as the health plan side, but I work for an independent physicians association. So I work really closely with nurses, the physicians, anyone from their medical staff, and we're contracted with about 14 health plans. So it's a little bit different, and I feel like I can do a lot of different things in this role.
That's great to hear. I also had a question about your career path. Was it difficult going into residency, after being in the field for a little bit? And, was it difficult making the big change, or what advice do you give people who are thinking about changing that, they're scared?
Yeah, that's a great question. So I actually think it helped me a lot having that community pharmacy experience first. I also was a pharmacy manager, so I just had like leadership skills that were built in from that position. So I actually think it made me a stronger resident, in my opinion. I moved across the country. I started my practicing in Rhode Island, and I moved to California. So that's like a complete 180. But it's a little scary at first, but I always think you should jump into all the opportunities you have. So what I tell anyone who asks me is like, if you can, don't let area define like where you're going to be. Just go for the opportunities you have, and life usually tends to work out the way it needs to.
That's great advice, especially, going into Appies and possibly applying for residency soon. So I appreciate it. Thank you. And then I know a lot of you already touched upon it, but, feel free to expand upon how you got to your current role and kind of, what led you to go from one practice site to another, or specific residencies. So I'd love to hear, kind of why you made the decisions you made.
I guess I'll finish my thought process since I was already there. So I started community pharmacy. It was great. I loved being a pharmacy manager. I managed the pharmacy I started at when I was 18. So I had known a lot of those patients since I was for like 8 years. So it was definitely a sad thing to go. But I will say that the thing I wanted to do most is have an impact on a larger scale, which is something I just couldn't do in a community setting. I loved what I did, but I wanted to reach more people. So for example, we have 400,000 members that we manage. So when I'm talking about a hypertension initiative I'm doing, I'm talking about like 10,000 patients rather than like the 2 patients I managed in the pharmacy that day. So it's definitely way different than what I was doing and is exactly where I wanted to be on a large scale. So that's why I kind of transitioned over and why I felt the need to pursue that.
That's fantastic. Wow.
I can go next. Just because I guess now that I'm in a role that doesn't really pertain as much, I would say, as to what I completed my residency in. So I love mental health. I knew that's always really what I wanted to do, or I felt like that's what I really wanted to do. And I had kind of committed to that early in PGY1 by doing a PGY1 focus in mental health. And then I stayed on my second year. But in my second year, when I was doing my rotations, I actually did a pain rotation and I really liked it, but it was kind of too late. I was like probably right at the end of my residency. So, and I really liked my current VA, and the role that they actually had open at the time was a substance use disorder role in the residential treatment program. And I always felt like, even within mental health, I really enjoyed, of course, like kind of outpatient, like primary care mental health integration, which is what it's referred to usually in the VA, like PCMHI. But I felt like substance use disorders, there can sometimes be a really kind of backwards way of treating it, and it's still looked at like that, and patients are still, I don't know, sometimes they're not treated the same. So that was something that I was really passionate about, and I really enjoyed working with patients with substance use disorders. Sometimes I think they can be one of the most difficult patient populations, but also the most rewarding when they're able to kind of reach their goals. And it's also interesting. You see different things all the time. There's always different things coming up. I mean, even the change in the opioid epidemic and going to fentanyl and the way we treat with buprenorphine, there are like little nuances. So it's been a lot of, I don't know if fun is the right word, but it's been really interesting and I've definitely enjoyed it. I've had some great experiences with some providers. So when I transitioned and I saw that a role was open in pain where I was looking to kind of move within the VA, once you're in the VA, you can kind of move around to different VAs, which is great. So once I saw that open, I was like, let me see. And I really liked the team. I thought they were great. And my substance use disorder kind of background really helped with me going into this new role. I'm definitely still learning all the time. I'm only about maybe like 6 months into my new role. So still stuff to learn, but I've had a lot of great resources, and I think my background has definitely been very helpful in my current role. So
Awesome. Thank you.
I can sort of piggyback off of that. So kind of on the opposite end of the spectrum, I had in my PGY1 residency, I had a program director that was, really, really great about getting you the experiences that you think you wanted to have before mid-year. So you could really dive into those topics before you went to mid-year and started preparing for a PGY2 and going to all the booster interviews and everything. So right before I went to mid-year during my PGY1 year, I was able to have the inpatient hematology oncology rotation at my program site, and I fell in love with it right away. And I knew exactly then that that's what I wanted to do. So I was lucky enough to have that experience and have a program that was willing to work with me and really get me what I thought I was interested in and get a good experience in that. So I would say dive into every topic that you can, and you never know, you might find something very interesting during your rotational year. And then you're able to sort of go off from there during your PGY1 year and take the next steps. That's not to say that you can't have your experience later in life and decide you want to change tracks. One of my colleagues at Maine Medical Center is actually PGY2 trained in critical care. and decided he didn't want to do critical care anymore, and now he's an oncology pharmacist with me. So you can certainly change paths whenever you really find your calling. So
Good to know. It's never too late.
Yeah, I'll add to that a little too, and just even say how you can continue to like refine and fine tune a bit your path along the way, and to kind of find those little areas even within your overarching job that you really want to continue to explore and more. So I actually did a rotation at Cherokee, North Carolina when I was P4, and it just all happened to work out. And it was when I said, wow, I really enjoy this. I knew I had wanted to do something in more of the outpatient space. Wasn't sure if it was more community focused PGY1 or a more general pharmacy practice with a little more AmCare. And then I was fortunate enough to do a residency with the Indian Health Service. So I moved out to New Mexico, had like never really been there before in life, but really knew that federal pharmacy was where you would be able to get to do a lot. In that time, while I really enjoyed it, I knew that I always wanted to go into academia. So knowing that, I kind of said, hey, while I enjoy this time federally and really being able to not have as many state restriction rules, and New Mexico is a really advanced practice state for pharmacy. I kind of went and wanted to go through some of the barriers of the non-federal system, knowing that I didn't know what kind of practice site I would have in the future. So then I went on and did a PGY2 at the University of Colorado, and was able to really kind of see a bunch of different high-level health system pharmacy, right? Some more like large population health type things, as well as some kind of day-to-day integrated into clinic, working in some FQHC, behavioral health, really kind of getting the broad experience of primary care. And even within then, based on my mentor and some of my own individual experience, we started to say, all right, of this whole primary care space, what do I want to do? So really then started to work and look and say, okay, lipids is an area of even within that kind of broader primary care that I see myself continuing to want to be an expert in. And then I was at Wayne State University for 2 years in Detroit as a faculty member, and had a collaborative role there where I was setting up some workflows for things like hypertension, continuing to grow in that space. And even there did a lot of work with health equity and implicit bias, and from some of the non-clinical standpoint, which really helped refine me to my current role now, where I've really been fortunate enough to integrate a lot of those same principles, both into my clinical practice, but also into teaching and research. And even now, for example, we have a gender affirming care clinic within my clinical practice site. And they don't meet that often per se, but really was a top priority for me to get involved with, as this is an area that I'm continuing to grow with. So really collaborating with the physicians there and continuing to now, work with them, being able to educate even to their medical residents. And we have medical residents on my clinic side as well. So really, even on that one pathway, you can continue to pick up and identify the little things that interest you most to really figure out, what you want to be that expert in and what you want to be able to grow in, even within a job that may have multiple different responsibilities.
That's fantastic.
I can go next, kind of pivoting a little bit. So my path to where I am right now, it's a little bit all over the place. It started off, I would say, a little bit rocky. I went through the phase 1 match as a student, and I actually did not match. And so I ended up going through the phase 2 match, and that's how I ended up at the University of Toledo Medical Center, where I did my PGY 1 year. And it honestly was a pretty good fit for what I wanted to get out of my PGY1. It was a relatively small hospital, though. It was a small academic medical center, and they actually did have a PGY2 in critical care there, which was my primary interest. But after rotating through a few of their ICUs, I kind of felt like I was not going to gain additional benefit from staying there another year. And so that's why I chose to go elsewhere for my PGY2. So all throughout all of this process in PGY1 and PGY2 year, I wasn't geographically restricted, which I think really helps when you're looking to gain a variety of different experiences. So I ended up interviewing at a few critical care programs throughout the country, mostly Houston and the Midwest. I really liked the Midwest pharmacy practice model. I liked they have a lot more clinical specialist models as opposed to some of the mixed operational models that's a lot of hospitals have. And so when I interviewed at MD Anderson Cancer Center, what I really fell in love with from their program was their preceptor groups, as well as the practice model that they had. They had a pretty unique pharmacy collaborative practice, which was essentially all encompassing for all of their inpatient pharmacists. That gave them really broad ability to essentially manage all inpatient medications, which I thought was very unique. And really, when you interview with different programs, you can tell whether or not you're going to really vibe with the preceptor groups there. And so I think that was very telling when I interviewed there, that I could just tell that it was a group of people that were very supportive and that I would fit in well with their preceptors. And so after my PGY2 year, there was honestly not a lot of critical care positions open at that time. The market really ebbs and flows in terms of specialty positions that are available from year to year. So that was a year that critical care positions, there's not a lot of. And there was my position open at Barnes Jewish Hospital when I was interviewing, and it was really just the perfect fit. Barnes Jewish Hospital had a pretty similar pharmacy practice model to where I was practicing as a resident. And the patient population was a really good fit for me as well, since that was essentially what I had trained my entire PGY2 in, which was oncology critical care. So I ended up taking that job and have been here since.
That's great. I love hearing how, you can do so many different things to get to where you are now. And so it's great hearing how you can constantly evolve what you're going to be doing. That's awesome. And transitioning a little bit into, what advice you can give the students who are currently, looking into what to do with their career. Hindsight's always 2020. So, what's something that you wish you knew while you were in pharmacy school that you think you could offer to students now that might help them? It could be about anything, whether it's have fun or things career-wise.
Get us started, even though many of the people on the call probably have to hear me chat about these things a little bit often. But no, I always say, be open, yet be intentional. I think that a lot of times as you're a student, as you're going, this club and you want this rotation or you want to do a project or whatever that may be, right? I think that understanding how you want that to fit into the bigger picture, right? Whether that is, hey, I was a secretary of this organization, we planned XYZ event, or hey, I helped to lead a board of people and it didn't always go so well. And here is, how we are able to overcome that. I think those little things, and particularly those fine skills that are going to be super applicable no matter where you go, are things that you don't always think about in the moment. But I think are really transferable to being a pharmacist, particularly working in different clinical settings or with a desire to go into residency or something like that. So I think doing that now, and even just having that running list of, stuff I did in school and being able to, what did you get out of it, right? Not just the title, but really what you think was kind of those big takeaway moments and how that would make you be a better pharmacist. I think when you go on interviews and you even are in practicing in the real world, being able to have that self-reflection to, leverage those experiences and speak to those with examples is really, really valuable. And then I'll also just add, I think that one, you're going to have an idea about what you think you want to do. But I think the people that are I think the most exciting to work with are ones that have a direction but don't yet know the path, right? They kind of know roughly what they think they're going to go. And then that's only going to continue to grow and develop and reroute along the way.
I can sort of follow it up, kind of close to it, but a little bit differently. May sound a little bit cliche, but take all of the opportunities that you have to get better at things that you struggle with. Everyone can probably say, like, presenting, they were like scared every time that they got up in front of a classroom or, you know, had to give a presentation. And my PGY1 program director knew that, and immediately in the first few months, I was giving a presentation at a regional conference at UVM. And, you know, the more and more I did it, the easier and easier it became. I know it sounds super cliche, but take all those opportunities to get better at things that you know you struggle at, because eventually one day you'll be like, this isn't so bad anymore. So I know it's super, super cliche, but take all the opportunities to get better at those things that you identify that you struggle at.
I can go next. One of the things that I will say that I've learned even kind of in my own career is that I feel like, after you finish pharmacy school, you feel like you know a lot. And of course, you know a lot. You just passed the NAPLEX, you're going on to your residency or you're going on to your new job, kind of doing whatever, you are doing or whatever your path is. But I think one of the best things is use your other pharmacists or your pharmacy friends as resources. I still reach out to my fellow pharmacy friends and ask them questions about things that maybe are their specialty and aren't my specialty. So, you know, my specialty does overlap with some things, but there are things that I haven't seen in years. And if I have a question or a concern, yeah, I definitely reach out to those people, or they can at least lead you in the right direction. There are things that you forget after years and years in pharmacy school. So, make sure you reach out and, keep in touch with your mentors too. I think that that's a great thing. It's hard, when you finish, you kind of lose touch, but I try to every once in a while do a check-in with a few of the people that I had, a great relationship with. So, try to check in with those people every once in a while and let them know about your accomplishments, because they certainly love to hear from you.
Anyone else?
I would say to keep an open mind. I feel like as a student, you start to develop an idea of exactly how you want your life to turn out and what your job is going to be and how you're going to specialize and where you're going to live. And I feel like throughout the process of applying for residencies and then jobs afterwards, if you keep an open mind, then that opens up just more opportunities. Throughout PGY1, you're going to have additional experiences, and you might find a rotation that you really love much more than you thought you would. And that might lead you to pivot to another PGY2 specialty that you hadn't considered. Or you might go to ASHP mid-year and talk to a random program that wasn't on your radar in a part of the country that you weren't previously considering. And it is just crazy how many different places and pharmacy practices there are in the country. And throughout my processes through this, I've just really valued all of the diverse experiences that I've been afforded. And I think it just really adds to you as a pharmacist and how you can talk to different experiences by practicing at various places in the country, as well as having just diverse experiences overall.
Yeah, I would say similarly to everything that everyone said is just don't let a pre-planned path dictate the choices you make and the opportunities you pursue. It's just really important to be very open. And I know a lot of us as pharmacy students, pharmacists are more on the type A side. We love a plan. We love being organized. But I think once you start to lean towards more experiences that will drive you to where you want to be rather than a pre-planned path, I think you'll be able to open a lot more doors for yourself.
Yeah, that's a really great point. I was thinking about, Elena's career path, and honestly, a bunch of yours, transitioning from, one role to another that might be a different specialty than what you initially planned. How did you feel prepared to make those changes? And, are you constantly learning? I'm thinking silly with Elena with going into pain management, when you initially did a residency in something else. How do you make those transitions in terms of knowledge base and yeah, how do you feel confident to continue on that path?
I think it can definitely be difficult, and I find myself struggling every once in a while with, testing my knowledge. Oh, do I really know this? Or what do I know about this? But you learn a lot as you go, and I'm definitely still close to where I was. I think in mental health and in pain, we have a lot of like overlapping medications, which is kind of nice. I get to take that with me. Then with substance use, we have some overlapping medications. I've taken that with me. And even when I was doing substance use disorder, I did enjoy kind of the pain management aspect too. So I would work on a lot of projects, even with some of the pain management pharmacists at the old VA that I was at in Richmond, which I think helped me as well. And use your resources within. So for anyone that's not familiar, within the VA system, you have your own VA in its own location. So we have Baltimore, but we're part of Vision 5, which is a larger network of VAs. So it includes VAs in West Virginia, like Martinsburg. It also includes the DC VA, which is great. So I have a group of pain pharmacists that I will, ask different ideas, and I will say, hey, has anyone had a patient who has had this before? And they'll kind of offer me guidance. So it is really nice. Don't ever feel like you're alone, because you're not. And you also have, your physicians and nurse practitioners. I talk to them too, and we talk about different things and discuss different patients. So, but yeah, it can definitely be challenging. I did do a lot of reading before I took this role and reviewed a lot of guidelines and stuff like that, so that I did feel, confident coming into this role. But yeah, there's always room to learn. I'm sure every single one of the pharmacists on this panel are still learning just as much as I am. So
That's great. I feel like lifelong learning is super important in pharmacy because, there are roles that don't even exist yet that I feel like we'll be in someday. So super exciting. Something that I was thinking about is I noticed that all of you are obviously in very different parts of the country and very different health systems and areas of practice. What's something you love about your job in terms of maybe scope of practice or, something in that regard? And what's something you think you admire about possibly another area that you wish, your part of the country had in terms of what you're able to do in your current position? It's pretty loaded. I just think about all this stuff.
I'll jump in. Get the most familiar. Yeah, so that was one of the reasons I did want to go away. I will say that I think that in the back of my mind, I had a feeling I would always want to come back. I didn't know when or how or in what way. But I knew that if I wanted to kind of do some big things here in Rhode Island, that I would want to kind of go away and have that experience to then be able to bring back. And I think I'm forever grateful for that. And I think particularly this actually ties in well to one of the points I wanted to raise of that, that while the clinical piece is a lot of this, a lot of places have grown from a lens of a sense of evaluation, right? And promotion of the profession, right? We are the medication experts, right? We can bring a lot to the table. And I think don't always be afraid to remember that, I think, as you go through. And also, even if you do be able to come back and bring something wherever you go, like even Gabby mentioned, like basically making together her own role, right? How are we going to learn to talk to non-pharmacy folks, right? We know what we're talking about all the time, but how do we translate those things to other healthcare professionals? What things do they care about in terms of their outcomes? But also, how do we justify pharmacy jobs and pharmacy lines in many ways? That's not always the first thing I think we think about. But ensuring and just kind of approaching it through that lens and talking it out with someone. And, if you want to expand and you want to grow, knowing what that's going to take and what would be a marker of success. And it's going to be change and be dynamic over time. But I think if you can approach even, your appies and your other experiences with that in mind, you can make a lot of really big change. And I think we're already seeing that in Rhode Island and continuing to see that grow throughout the country more and more.
I think so. I think I'm the only one who works at a VA. So I'll talk about my role a little bit. Which Joe kind of touched on. So within the VA, you're part of the federal like healthcare systems. So I actually have my own scope of practice. So my scope of practice is like pretty specific. So it's really only, it's for anything related to pain management. So that can be used somewhat liberally, but primarily, anything related to pain management. But in the sense, like, let's say I have a patient, on chronic opioid therapy, they need meds for constipation. I can definitely prescribe that. So I'm not limited in really what I can prescribe. I will say, so there is an opportunity for pharmacists to prescribe controlled substances. Unfortunately, my VA is not quite as supportive of that, but eventually they're going to agree with me and they're going to allow it. It takes a little bit of time, but currently right now they don't allow that. So I can't prescribe any like buprenorphine products for pain or even any chronic opioid therapy. So I do work very closely with the providers for that. So I'd say that's where it's definitely similar to some of our like collaborative practice agreements. And I usually will make recommendations or I reach out to the provider directly. Some physicians will let me just put in the med order for them and they just kind of sign off on it because they're familiar with me. So it definitely depends. But for anything else, like if I was going to do duloxetine, for example, I can put that order in by myself and, do monitoring, refills, everything related to that, which I think is really great. I think that was one of the things that drew me to the VA, but I will say every VA is extremely different in terms of scope of practice and expectation. I can remember being on rotations and seeing the VA in other states, even in compared to where I was in Richmond, and the Richmond pharmacists were just unbelievable with some of the recommendations they made and some of the medication management. But there's definitely a wide variety across the country. So even when you're interviewing, understanding kind of what the pharmacist does more closely on a day-to-day role, what kind of medications are you prescribing, like in particular, and what classes of medications, you can kind of get a good idea of exactly, where their medication management falls and what they kind of feel comfortable prescribing, because that does vary even between pharmacists too.
Anyone else want to jump in? If not, we can head on to questions, but just wanted to see.
I think for me, I went from practicing in the smallest state to the largest state. So it's a lot different. I think the most eye-opening thing for me was just the diversity here and learning like how many different types of patient populations there are. Like for instance, if we have an automated message we send out, there's 15 common languages it goes out in, whereas in Rhode Island, that's just not what it was. So it's just learning to practice a little bit differently. When I'm thinking of an initiative, I have to think about all of the different areas to cover rather than maybe a smaller scope I had in Rhode Island. So it's just a different line of thinking, but I really enjoy it being that diverse.
Emily or Brady, anything you want to add? If not, it's totally fine.
I guess one thing that I'll add, since I've been in a couple different places in the country, what I really like about working at my hospital in St. Louis is our pharmacy practice model as a clinical specialist model. We have a lot more flexibility in our day-to-day. Patient care is always the first priority for the day, rounding with the medical team. But then since we're not doing any operational or order verification as part of our job, then our post rounds time is really up to us to fill in with whatever we would like to be involved with. And so for a lot of us, that is teaching. So either didactic teaching as adjunct faculty for the College of Pharmacy in St. Louis, teaching of students, teaching of residents, as well as being involved with research with our physicians. And we are all pretty much heavily involved in various committees throughout the hospital. And since Barnes is part of a large hospital system, we're the largest academic medical center within that system. It's primarily our pharmacists that take a lot of order set and policy and procedural optimizations through committees, which can be pretty time consuming, but it also gives our pharmacy department a lot of control and input over how things in Epic are built and optimized, as well as pretty heavy involvement in policy developments throughout the hospital. So I really enjoyed that aspect of my job, the QI, as well as the ability to be involved in research and having a lot of my day to be able to devote to those things. What I would say was kind of surprising once I moved to St. Louis is um, the Missouri is pretty strict in terms of its pharmacy collaborative practice agreements and pharmacy scope of practice. It's a little bit more limited than when I practiced in Texas as well as Ohio. And I would say that ambulatory care isn't as well built up specifically in the St. Louis area. And I would say that a lot of the ambulatory care that I saw while I was in Rhode Island as a student was some of the top in terms of pharmacists practicing at the top of their license compared to some of the other places I've been in the Midwest. So it really is just diverse across the country. And it can change from city to city within a state, as well as from state to state.
I guess I'll add just one little piece of information that everyone. I echo everything that everyone said, but one thing that I really appreciate about Maine Med, and I heard this countless times as I went through the interview process as a resident, that the providers, the oncology providers specifically here, were all fresh out of fellowship and really, really pharmacy friendly because they came from places that trained that pharmacy was heavily involved. So I stepped in and I immediately saw that, and really working with providers that really want pharmacy to have a seat at the table, whether it comes to policy writing or even rounding, is really important. So like I said, I heard that throughout my interview day. I remember vividly hearing that, and I have felt that since I've been here as a resident and continued on as my career here as a pharmacist. So really that working relationship with providers is really important.
I'll just add one nice thing. I think that listening to kind of everybody talk about their experience, and really particularly for the current students, like you're gonna make an impact really wherever you go, right? Whether it's whatever, big state, small state, the large academic tier one medical center, or a small community hospital that you can do a lot with. And I think really, we all are kind of from the lens of you're going to pick up little skills along the way to really be able to implement those everywhere. I think even when working with students, often where they're selecting where they want to go for PGY1, or they have the big names or whatever that may be in mind. And I think really being open to the idea that, whatever, you're going to get a fantastic experience wherever you go. And also you're only just putting tools in the toolbox to be able to, pick it up together, and it's always going to grow, and you're going to keep putting them together. And like your one idea of what you think you're going to do is going to change. And it may not be in a certain place, or it may not be either like the hospital or the geographic place. But I think no matter where it is, if you have a mindset that's you want to grow and you want to learn something, you're always going to be prepared for the current role and what's to come.
Yeah, thank you, Dr. Narlow. That was a really great perspective. I think that summarized everything nicely. So we have a little under 10 minutes left, and I just want to open up the floor to any questions from anyone. You can feel free to unmute yourself or throw it in the chat. I feel like everyone answered so many amazing things, but if there's anything in particular you're looking to hear, definitely let us know. If not, I always have more questions.
I feel like every pharmacist has one part of their job that they really end up loving. What do you feel is the most fulfilling part of your job? I know every practice site has different unique aspects that people fall in love with.
Did everyone hear his question, or does anyone can answer it?
It was a little bit broken up. Would you be able to repeat it?
Or you can always type it in the chat. I know I did see one question in the chat. I think it might be a prospective student. But yeah, just to clarify, so the PharmD program at URI is a 6-year program, and you graduate after 6 years with your PharmD, and you can either go straight into practice, like Gabby did, where she worked at a CVS, or sorry, I don't know if it's CVS in particular, a retail pharmacy. Okay. But if you pursue a residency, that would be, you can either do it right after pharmacy school, like a few of them did, or you can go back like Gabby did. So you can kind of follow a couple different paths. But if you're interested in pursuing a residency, many people tend to do it right after their 6 years.
I'll just add to that too, that I think that is one of the things about URI, that we are really lucky that we get all of it done in a 6-year period. And I think that, especially if you're coming like right out of high school, for example, and doing the full 6 years here, that you really are kind of at a jump start in many ways to pursue some of that additional training if you wish to do so. I have a lot of friends who are at other pharmacy schools throughout the country, for example, and to know that, a lot of people end up in their young 20s being able to then kind of make some of these decisions and try new things and explore a bit more is a really exciting piece of it. And I don't think that's not something that's really common at a ton of different schools. So it kind of gives you that little bit of security. Plus, I think we do a really good job here in helping people match up to where they would fit best and give them experiences to prepare them for that.
Definitely. And I do want to add that we have an amazing match rate at URI, like one of the best in the country. So that also helps a lot. And then I see Ryan's question that he threw in the chat. What part of your job do you feel is most fulfilling? I think that'll be our last question of the night.
I feel like this is so cliche, but I always say my patients. I think my patients can sometimes be my toughest critics, but they can also be so fulfilling. And seeing them do well is just so amazing. Even today, I reached out to like rheumatology about a patient, and he sent me a really nice message about a veteran that she was so anxious when she first came to the VA, and now she's seeing me and um, doctors in the clinic, and she like almost gave her rheumatology provider a hug, saying how great her experience has been with the chronic pain service. And I just saw her earlier today. So it's just really nice hearing some of those things. I think patients are very fulfilling, and then any compliments that you get from, I guess, our higher level providers. So when I have a physician tell me, oh, you did a really great job with that patient, or that was really cool. Like, how did you figure that out? I have physicians that will ask me for primary literature, even though they certainly know how to do it. But as pharmacists, I feel like we certainly have a great knowledge base. So it is really nice to hear that as well. I find that compliment very fulfilling.
I see we're getting more questions in the chat. I just want to mention that this will end around 8 o'clock, but feel free to reach out to our email that's on the admissions website, and we can answer any questions you have. Sorry to cut you off, Bree.
No. I saw a question there that said, how did URI prepare you to be a hospital pharmacist in terms of opportunities, program, and location? I spoke to this. I was actually on campus a little bit yesterday. I spoke to this a little bit yesterday, but fully take advantage of every opportunity that the URI professors and faculty provide for you guys as students, because I have been to several pharmacy schools, and nowhere else have I seen the amount of preparation that goes into CV preparation, letter of intent building, mock interviews. All of these, I would not be sitting where I am today without all of these services that were offered to me. I fully took advantage of each and every one of those opportunities. And I can say, sitting in that first interview, I didn't feel nervous at all. I felt so incredibly ready, and I have everyone at URI to thank for that.
I can just touch on for really, really quickly to our prospective student that, in terms of different opportunities for pharmacy in global and international settings. So I co-chair our diversity and globalization committee. We actually had a visit from the University of Cape Coast in Ghana recently, from some of their faculty and their administration from here. So continuing to grow that collaboration. We have different student organizations that have done some work. I was actually fortunate enough when I was a student to go with Dr. Charpentier, who's the advisor of SSHP, on a trip to Guatemala. So I think really building those experiences with faculty, and excited to continue to see where we grow them in the future as well.
Awesome. Well, thank you all for answering those last couple questions there. I really appreciate it. And I just wanted to take the time to thank everyone for joining us today, and thank you to our amazing alumni who also donated their time. So we're going to go ahead and end the panel there, but thank you all, and I hope you have a great night.